Hello, Dr. Raymer here. You'll notice my camera isn't working, so you're missing my little talking head. You can have some covert videos going on here, but who knows, maybe my head's just annoying anyway. So today we're talking about sectional anatomy of the brainstem. 3 sort of learning outcomes for this. First, identifying sections of brainstem, and we'll use histological and anatomical landmarks to do that. Histology being, of course, internal or microscopic anatomy. Next, localize specific cranial nerves to different levels of the brainstem, and that sets the foundation for this when we get started on linking the functional outcome of damage to different portions in the brainstem to its neuroanatomy. So in gross anatomy, we use external anatomical landmarks to divide the brainstem into its 3 major regions: the midbrain, the pons, and the medulla oblongata. And of course, it's really this ventral basal pons that's the major landmark here. It allows us to really readily divide the brainstem up into these 3 regions. In sectional anatomy, we're going to get a bit more detailed than that. So we'll look at the internal structure of these 3 regions and subdivide each region into rostral and caudal, with characteristic nuclei and tracts present at each level. And this is the level of anatomical detail that we need to link damage in the brainstem to neurological signs and symptoms. Here we're looking at a transverse section of the rostral midbrain at the level of the superior colliculus. And if we go back to this slide for a moment, the superior colliculus is a feature of the dorsal brainstem, little bumps right there. So that's about the level that we're at on this slide to give you a frame of reference. If we look at this nice color coding, this is a section actually from this website, which is very cool to play around with. The color coding is really nice on section. Of course, the goal is to be able to identify each structure in the brainstem at different levels without the helpful color coding, but it's a nice place to start. And we're going to look at transverse sections of brainstem, and I should say, typically we only look at the brainstem in transverse section. It's the most informative. So we'll look at sections to identify gray matter and white matter. And in this section, for example, the really prominent nucleus is the red nucleus. So that's helpfully color-coded in red here. A big prominent nucleus containing the cell bodies of the rubrospinal tract. That's present. It's a marker for the rostral midbrain. On the ventral side of the midbrain, in purple here, you can see the cerebral peduncles. And of course, we know they contain white matter tracts, notably the corticospinal and corticobulbar tracts. Now, some other terminology you'll hear divides the brainstem into dorsal and ventral portions. And 2 words are the tegmentum and the tectum. So the tegmentum, which is color-coded in green in these 3 sections, is the floor of the whole ventricular system. The tectum is the roof. And so if we move sort of left to right on the slide, we're going from caudal to rostral along these 3 sections. Here we're looking at the medulla, and I can tell because I see the medullary pyramids ventrally. This inferior olivary nucleus, the squiggly, which is a great marker for being in the medulla, and the tegmentum. And so there's no tectum in the medulla. This is the floor of the 4th ventricle. So we've only got tegmentum. As we move rostrally, here we're in the basal pons, and it's really tough to miss the basal pons. It looks like this. The pons is actually, it's got a whole bunch of white matter tracts passing through it, and so they pass both transversely and obviously rostrocaudally as they're traveling from body to brain and brain to body. In the pons, you get a little bit of tectum emerging. So there is a little bit of roof. This is over the most rostral portion of the 4th ventricle. And finally, here we're up in the midbrain. We've got these prominent cerebral peduncles ventrally, and we've got a prominent tectum. So this is the colliculi, prominent bumps saying, oh yes, okay, I know I'm in the midbrain because I've got those, and they're overlying the cerebral aqueduct, which of course connects the 3rd ventricle to the 4th ventricle. So tectum and tegmentum is the dorsal side of the midbrain, of the brainstem, and the most ventral portion is the base or basis, and that's what's shown in red in all three sections. So when you use anatomical language to describe the position of a structure in the brainstem, you can describe it according to position along three axes. So the rostral caudal axis, of course, where it is in the brainstem, the dorsal ventral axis, as we just discussed, and the mediolateral axis. So if we take our example here of the superior colliculus in the rostral midbrain, we would describe it as being in the rostral midbrain, that's its rostral caudal position, dorsally, or in the tectum, and medially located. We can see it's close to the midline. Now, at every level, the brainstem contains both nuclei and white matter tracts passing through it. So there's just relatively discrete nuclei that are present within each section, and then the white matter that's just journeying through it in either direction. And one thing that's important right away when you look at a histological stain is to sort out whether white matter appears dark or light, because it depends on the staining. So here we have a section of the medulla, and I immediately can see that in this section, the dark purple is the white matter tracts, and the light staining is the gray matter. So here we have the pyramids ventrally, and if you were to look at the predominant direction of axons, or sort of orientation of axons in the pyramids, they're kind of traveling rostral caudally. And so in this section, you could imagine little cross sections of axons being round. Now you can also see axons passing through the section traveling this way. And the internal arcuate fibers are an example of this. So I can see them sweeping across the section. So their predominant orientation in the section would be longitudinal. And finally, I can see nuclei, which are relatively gray. So here's a nucleus of cranial nerve 5, and here's a nucleus. There's the cuneate nucleus, for example, and the nucleus gracilis. And so they are relatively light. And so we're looking at both nuclei and tracts, and of course we know there's three major tracts that we use for neurological testing. Now, we talk a lot about the corticospinal tract, but most people are a little less familiar with the corticobulbar tract. So let's talk about that for a second. So the corticobulbar tract contains the axons of upper motor neurons that govern muscles of the head, face, and neck. If we look at our diagram here, we've got our motor homunculus shown on this side. This alarming structure is a tongue. And we now know that homunculus has been a bit modified, but there's the dogmatic version. And then on the contralateral side, we've got the sort of axons, schematically neurons and axons representing upper motor neurons. And so the corticospinal tract is shown in blue, and the corticobulbar tract is shown here in red. And the corticobulbar tract originates from the most lateral portion of the primary motor cortex, and then travels with the corticospinal tract caudally to the brainstem. In the brainstem, what happens is corticobulbar axons peel off at different levels. And so they peel off, for example, in the midbrain to cranial nerves 3, 4, and 6, governing movements of the eyes. In the pons, cranial nerves 5 and 7 predominantly. And in the medulla, the lower cranial nerves, so 9, 10, 11, and 12. What this diagram doesn't show is a really important feature of control of the corticobulbar tract, and that is that most cranial nerve motor nuclei receive bilateral input from the motor cortex. And so what this should really look like is not just an axon peeling off of the corticobulbar tract and traveling to the opposite side of the midbrain, but also an axon peeling off at the same level to interfate those nuclei on the ipsilateral side. And so it's bilateral control for almost all cranial nerve motor nuclei. The exceptions that are important clinically are here. So first, cranial nerve 7, for part of the nucleus only, we probably already know, neurons innervating the lower facial muscles. So the muscles below the eyebrows are unilaterally innervated. And the same is true for cranial nerve 12 for the neurons innervating some of the tongue muscles, notably genioglossus. So we can use these exceptions clinically because they have unilateral, contralateral control reminiscent of what we see in the corticospinal tract. Now, importantly, bilaterally innervated structures can exhibit some weakness after an upper motor neuron lesion, but it's often weakness, not paralysis, and it's often transient. And that's because of this bilateral control. Now, of course, we know that two major ascending systems or pathways carry sensory information from the body to the brain. And we have the dorsal column medial lemniscus pathway, as well as the spinal thalamic tract as part of the anterolateral system. And I think most of us are quite familiar with these pathways by now. I'll just mention one thing. At the level of the nucleus cuneatus and nucleus gracilis in the medulla, the axons that leave there and cross the midline to ascend to the thalamus are the internal arcuate fibers. And so those are those internal arcuate fibers that we saw in that histological section of the medulla. Now, what happens as we ascend from spinal cord to brainstem is that sensory information entering from cranial nerves joins the ascending pathways from the spinal cord in a modality-specific way. So light touch, proprioception, etc., that type of information joins the medial lemniscus. You can see it entering from these cranial nerves here, and it joins the medial lemniscus to ascend. And information from spinal thalamic related modalities, the same set of cranial nerves but different receptors and primary sensory neurons, enters and joins the spinal thalamic tract to ascend. And so just remembering that information is entering cumulatively as we ascend. And now we have to add the brainstem on at the top of the spinal cord. So let's move through the brainstem and transverse section now. We'll go caudal to rostral, starting at the caudal medulla, and at each of these levels, we'll identify the position of nuclei and the major tracts. Some important points about the sectional anatomy. How do you start? First, orient yourself to the cross section. It's almost always in the correct orientation, but you need to double check that. The orientation I expect is ventral at the bottom. The second is determine whether white matter appears dark or light. The third is to use landmarks to determine where you are in the brainstem. That's the sort of most important delineation. And then within that section, you want to localize sort of 5 sets of structures. The major central nervous system nuclei, like the thalamus, for example, or the red nucleus, the cranial nerve nuclei, and then the 3 major tracts. So here we're in the caudal medulla. Let's start here. It's also called the closed medulla, and it's right at the junction with the spinal cord. So this is your reference line for the section, and this is the ventral and dorsal view of the brainstem. Obviously, dorsally, the cerebellum's been cut away here. And so that's your reference point. And you can pick out the caudal medulla really readily in a number of ways. One is the pyramidal decussation. So the pyramids are very visible ventrally, but if you catch them at the decussation, right, sort of at the bottom of the medulla where they're crossing, they smear across the midline, and they look quite different than they do when we move just a bit more rostrally. The spinal thalamic tract is large, visible laterally, occupying a large portion of this lateral part of the section. And actually, we're just at the level of the junction with the spinal cord. This is a bit of anterior or ventral horn, so continuous with the cervical spinal cord here. In terms of nuclei, I can see the nucleus gracilis, visible near the midline, bilaterally, obviously, and the nucleus cuneatus. And so we're just catching the bottom of those nuclei, and adjacent to the nuclei in the same section are the relevant tracts. So there's the fasciculus gracilis and the fasciculus cuneatus. And so again, white matter is dark and nuclei are light. Here is the caudal bit of the nucleus for cranial nerve 5, which extends long distances rostralcaudally in the brainstem. And so we're just catching the caudal extent of that nucleus there. And so this is what I mean about that nucleus. You can see it extends for long distances. And so here we're catching the caudal, whoops, I'm on the wrong level, caudal bit of the nucleus. And that's a frame of reference from a different section showing you where we are. Here is the nucleus. That's the lighter portion here. And immediately adjacent to it is the relevant tract, the spinal trigeminal tract. And so you can see axons actually in both orientations, right? Axons exiting the nucleus to enter that tract where they'll ascend to the thalamus. So if you think about what's going where at this level, in the caudal or closed medulla, the corticospinal tract ventrally is in the process of crossing, whereas the fasciculi, cuneatus and gracilis, are just arriving at their nuclei, and they haven't crossed yet. So here we move just a bit rostrally. We're in the middle of the medulla, and I can tell because the pyramids are now distinct bundles of white matter ventrally, and so they're not in the process of crossing anymore. Dorsally, you have both nuclei relevant to the dorsal columns, large and visible, and you also see now the medial lemniscus become visible in this section. So it's worth thinking about this just for a second and remembering which is crossed here and which is uncrossed. And so the terminology is important here. So the medial lemniscus is the rostral continuation of the dorsal column medial lemniscus pathway. In the spinal cord, we call it the dorsal columns, and the medial lemniscus is only present in the brainstem. And so it's the dorsal columns to the point of the nuclei in the medulla, and distal to that point in the pathway, it's the medial lemniscus, which is abbreviated in section usually by ML. So what this means functionally, when we look at this section of the mid-medulla, anatomically and functionally, is that this section contains both uncrossed and crossed components of the dorsal column medial lemniscus system. The fasciculus cuneatus in this section is still visible. You can see we're running out of fasciculus gracilis medially. So most of those axons have already synapsed in the nucleus gracilis. The fasciculus cuneatus, those axons are still at the process of arriving to synapse at the nucleus cuneatus. So the fasciculus cuneatus is uncrossed, while the medial lemniscus is crossed already. So that's important in terms of localizing damage. You can just see something peeking in here. This is the caudal bit of the inferior olivary nucleus, which we'll talk about in a second. Now here we're looking at the rostral medulla or open medulla, and I should say that that term, closed versus open, indicates that this is open to the fourth ventricle. So that's the first feature of this section at this level. You can still see the pyramids ventrally as discrete bundles of white matter, but they're sort of overshadowed by what's now a super prominent inferior olivary nucleus. And so this squiggly thing, I always think it looks sort of like a walnut, is a really good marker to say, okay, I know now, I'm confident that I'm in the rostral medulla. A bit of terminology here, the anatomical bump is called the olive, and the nucleus that creates the bump, deep to it, is the olivary nucleus or inferior olivary nucleus, synonymous terms. Here's the medial lemniscus, again, prominent, discrete bundle on the midline. And we can see some other nuclei, notably, of course, that long nucleus of cranial nerve 5 and the relevant tract adjacent to it. Now, one thing I haven't mentioned yet, but it can be confusing about the labeling on these sections, is medial lemniscus versus M, which is actually the medial longitudinal fasciculus. So we'll talk about M, this mysterious white matter tract, also localized on the midline, which is important for conjugate gaze or movement of the eyes. So we're coming to that, but this is the medial lemniscus we know and love. Now, while it's not labeled in this section, there's another clinically important nucleus at this level in the open medulla, and it's right here. And that is the hypoglossal nucleus. So cranial nerve 12. And so the hypoglossal nucleus is there. There's also dorsal motor nucleus of the vagus and nucleus of the solitary tract, but clinically we're going to focus on this hypoglossal nucleus for cranial nerve 12. So here we are in the caudal pons, and the basal pons is pretty distinctive in section. It's easy to say, okay, I recognize that I'm in the pons. In the caudal portion of the pons, you can see your reference section here. So just at the caudal basal pons, you're actually at the level of the cerebellar peduncles. So the connections between the pons and the cerebellum. And these are extensive. And so you see them as big. Here's the middle cerebellar peduncle and the inferior cerebellar peduncle, and a little bit of the superior cerebellar peduncle. So big swaths of white matter along the lateral portion of a transverse section. And that is those peduncles that link pons to cerebellum. In addition, all of these, see these transverse pontine fibers, they're pontine cerebellar fibers. So there's fibers through the basal pons that are going transversely through the section. Here's the corticospinal tract. It's still visible, obviously, still traveling through, still relatively ventrally located. If you were to imagine the orientation of the axons in section, again, in this section, you'd be cutting these axons transversely. They'd be little round sections because they're going rostrocaudally, while these axons you'd capture longitudinally like this because they're linking pons to cerebellum transversely. Now, clinically, it's important to note that at this level of the pons, in the caudal pons, we have the abducens or abducent nucleus for cranial nerve 6. And so that nucleus is visible right here in that section. So just to orient you, I'm right here. There I am. And that's what we're capturing here on the schematic. So we can see that's the level of the section. And the abducent nucleus works in conjunction with the trochlear and ocular motor nuclei. They're located up in the brainstem. The abducent nucleus is in the caudal pons. And of interest, the tract that links them functionally is this mysterious M, which is the medial longitudinal fasciculus. Now the mid-pons is right at the top of the fourth ventricle. And I will say the distinguishing between the caudal pons and the mid-pons, it can be tough. And so that's a bit of a tough distinction. The sort of orientation looks relatively similar. The superior cerebellar peduncle and the middle cerebellar peduncle are present. The inferior cerebellar peduncle is now absent. We're too far rostral. And in this section is where, if you look at your reference point, the trigeminal nerve exits. So gross anatomy, that's where the trigeminal nerve is attached at the level of the mid-pons. I should also say that when we look at the basal pons, it's perhaps the best example of obvious complexity of brainstem anatomy. We're talking about select tracts and select nuclei, but of course there's a whole bunch of other nuclei occupying this space. There's sort of globally described here as pontine nuclei. So all of the light substance in here, tissue, is nuclei governing various function. And so we're not talking about them, but important to remember that they're still there. And they're dispersed amongst white matter, passing both transversely and rostrocaudally, and obviously obliquely through this section. Now the rostral pons is really easy to distinguish from the caudal and mid-pons. We're just now capturing the top of the fourth ventricle, we're at the junction of the pons and midbrain. When you look at the section, you sort of see the same pattern in the basal pons, but the medial lemniscus is a bit more lateral now. So that's important to recognize. And we're almost completely out of the cerebellar peduncles. Here's the last of the superior cerebellar peduncles in that section. Now here we are in the caudal midbrain. So here's your point of reference. And you can see that your first marker for midbrain is the colliculi. And so here in the caudal midbrain, this is the inferior colliculus, round nuclei bilaterally. We've also now, we're rostral to the level of the fourth ventricle, so this is the cerebral aqueduct. It's small, and it's contained in the periaqueductal gray matter. And so you can see this ring of gray matter surrounding the small ventricular space. So lots of good landmarks for knowing where we are. We're in the caudal midbrain. Ventrally, what's happening is that the basal pons is gone, and it's replaced now by the cerebral peduncles. So the cerebral peduncles have emerged, and you can see them on gross anatomy and now in section. Now, clinically, an important feature of the caudal midbrain is that it contains the trochlear nucleus. And so recall that the trochlear nerve is one of the only nerve that exits the dorsal surface of the brainstem, and here it is, this little tiny nerve that wraps around the brainstem to govern an eye muscle. And here it is, this tiny little nucleus in section. So just to give you a frame of reference, this is where we are here. And if we zoom in, this is the little trochlear nucleus, this little indentation of gray matter at the level of the inferior colliculi. You can see it's directly adjacent to that critical fasciculus for motor control of the eyes, the medial longitudinal fasciculus, and to the big swath of gray matter, the periaqueductal gray. And finally, last but not least, we're in the rostral midbrain. So it contains, obviously, the rostral continuation of the cerebral aqueduct. And now the superior colliculi are visible dorsally. Sort of trace them. The cerebral peduncles are visible laterally and ventrally, but couple of really nice markers for this section. We've already talked about the red nucleus, so it's not shown on this section, but it's here. And also now you can see the substantia nigra. So the substantia nigra, which looks black in sort of just dissection, fresh or fixed dissection, appears white here. So this is all substantia nigra, except where it's interrupted by axons of cranial nerve 3. So you can see them traveling through to exit the brainstem ventrally, where of course they're going to govern 4 muscles mediating movement of the eyeballs in the orbit. Now, in terms of clinical importance, the rostral midbrain contains the ocular motor nucleus, and that's actually a collection of discrete motor nuclei that innervate 4 different somatic muscles, the medial rectus, superior rectus, inferior rectus, and inferior oblique, as well as an autonomic nucleus, which is the Edinger-Westphal nucleus, which innervates the pupillary constrictor and the ciliary muscle. Where are we on this section, you ask? We need to change the control of the pen, actually, because that's failed us mysteriously. We are right here. So if you look at this little box, I'll try and make an accurate box. That's always difficult to do. Boop, boop, boop. There we are. And look in higher magnification, you can see the ocular motor nuclei right here along the midline.